To diagnose hidradenitis suppurativa or HS is so important because we are finding that earlier intervention gives better outcomes. The goal is to reduce that tendency towards scarring, because if we can reduce that tendency, then maybe we can find that patients are much more comfortable and get that pain management part of this under better control. There really are 3 criteria to fulfill to have a diagnosis of HS. We see deep-seated, painful nodules, generally in the folds, the flexural areas, and they tend to be recurrent. HS is usually diagnosed by a dermatologist. However, many times patients have already seen other doctors prior to seeing their dermatologist. Once that recurrent nature is identified, then patients are often seen by their dermatologist. So we don't need to take biopsies or samples of skin necessarily to diagnose this. Really, to diagnose HS boils down to the clinical history the patient has gone through. We want to get a sense of where those nodules are, what types of symptoms they're experiencing, as well as that recurrent nature. So much of this is just communicating with the patient to get that diagnosis right. For the most part, it's examining a patient in those areas that they find that are affected by HS. They might find that we look under the arms, under the breasts, between the buttocks, and the fold between the hip and the groin. I've had patients that even have neck or scalp involvement as well, or behind the ears. We want to primarily look at those folds of skin to see if there's any evidence of any of those nodules. Some patients may be so focused on the most painful ones, they might not even know others exist. There are so many other conditions that are often misdiagnosed for HS that it's really important to make sure that you get the diagnosis right before you start to worry about next steps. If you're diagnosed with HS, your doctor will discuss with you the next steps, really based on where you present in the course of disease. A lot of times we'll focus on getting that inflammatory response under control. It's all about focusing on where you're at with the symptoms that you're experiencing and the steps that we can take to address those for you.